Clare Maxwell here at Embodied Learning Systems. We're talking today about the 6 fundamental movements that I include in my cranial nerve sequencing course. These can be done for their own sake. When we study the 12 cranial nerves and the 7 sense organs, I call them 7 sense organs, that are innervated by those nerves, it gives us many, many different ways we can explore these fundamental movements. But let me just teach you today what those movements are, and I hope you can take these and use them right away. The most important anatomical piece to understand is this articulation of your brain and head, the top segment of your structure, which is the foundational piece of Alexander technique. And if you want to find that, you just put your hand underneath your ear. It's a little dip there between your jaw, the back of your jaw, and there's like a bump part of your head that's called mandibular process, and there's a little kind of a gap in between. And you can kind of point in there, softening the tip of your fingers a little bit, and just see if you can bring about a movement above that level. So when we use the word head or face or whatever, we're talking about that articulation of your skull as a container, and that's where the movement is at the top joint. So that's the first fundamental movement, and let's just make it from the sense organ of our nose today for simplicity's sake. So the first 2 fundamental movements, so simple. It's just the dipping of your nose, and it's very, very tiny. So you're looking, it's almost like you were sniffing the air slightly below your usual spot. And there's just this tiny, tiny movement of your head to make that happen. And just stay there for a little bit, breathing, noticing how the balance of your whole body over your feet, you should be standing, or over your hips if you're sitting. Notice how there's a little bit of a shift, a balancing, and then bringing your nose back up to the midline. And then tipping your nose up a little bit. You could do this with your eyes closed if you want, because it's really a tiny, tiny movement. And just enjoy watching your balancing and postural system, how it adjusts when you breathe and smell from a slightly higher place, and then bringing your head back. So that's the first fundamental movement, forward and back. And that very top joint of your spine, that's what it's designed for. So what you want to do is find that articulation as the beginning of a movement that can then include your whole body. So that would look like this. I'll do it from the side. And this, you might do it as small or as large as your body is able to do. So smelling, feeling the air inside your nose, and just knowing that you're breathing and tipping your nose down, and just noticing your ankle joints and how the weight shifts, and smelling, softening, and just knowing that this top segment up above that joint is moving. You do not have to try to stretch anything. You're just letting the whole body from the top of your head down to your ankle and foot move. And then unfolding your body again. And still breathing. Might get a little dizzy there. And then a slight tip up, just making sure that you've really accessed the top part of you that you can't see. It's really hard to feel your head. You can kind of breathe into the sinuses and then letting the whole back body kind of tone up. And you might shift forward at the ankle a little bit and then come back. It could be very, very small. What is sponsoring this whole channel is my cranial nerve sequencing course, which covers 6 fundamental movements, 12 nerves, 7 sense organs, all to help you increase your vitality as a counselor, therapist, one-on-one practitioner. This is foundational embodiment work that will enhance your understanding of more sophisticated embodiment work like trauma-based nervous system practices, EMDR, all of these things that are being taught in the field today. This is a foundational course. Thank you so much for watching. If you're interested, you can connect in the description box below. Okay, the second movement, I'm going to come closer. So you've got that, and that vertebrae is like this, and your head sits on it. The second vertebra is a little pedicle, and it sticks up, and this vertebra rotates around it. So when one of your sense organs is interested in something, there's this ability to turn, and that starts pretty high up in your spine. So you could use your eyes for this one. It's pretty easy, just to look slightly to the left and see. If you don't, try to hold your breath, or you don't have to put any postural ideas into place. You'll start to feel movement lower down and then coming back to the center. And then looking just slightly, it's so small, to the right. And coming back to the center. Many different movement forms have simple practices where you look to the left and you look to the right and you spiral. So if I come further back and you can see my whole body, it's helpful for rotation through your body to put your heels together. And so if you do this same gentle turning of the head to the left and the eyes to the left, and you don't try in the rest of your body to contract any muscles or make anything happen, you'll feel a movement at your ankle joint. And then it gets a little bit easier, and you can just look as far as is easy, and then come back to center, and then looking to the other side, my right side, your left side. And waiting, just waiting for a little bit of ease and movement at your ankle, and then coming back. And you can kind of repeat this movement as much as you like, because what you'll notice as you attend to that tiny beginning of the rotation very high up, that it starts to open up and you can turn a little bit more. So you get rotational motion and vitality. And then the last movement is, God, I'm spacing it out. Oh, this is actually one of my favorite ones. So, and this is one many of us avoid doing because of the vestibular system. But if you come back up to the top of your spine and you just tip one of your ears down, the other one will tip up, and the roof of your mouth is kind of tipping, and just make it as small as you can, because it's huge. It takes a while for your system to adjust to that, and then come up. And what you notice if you do these really gentle, you can think of it as a little bit of an engagement on the side that your ear is going down towards, like a little toning along the muscles along that side of your body, and an opening of the other side of your body. So stepping back And begin your side tipping. So this one maybe is easier to lead from your ear, and see if you can let your ankles move. So it's a softening of one whole side of your body and an opening of the other. You might even think of this as a toning, and then a rebalancing. And take special time to let that top segment of your head from the top joint first, and then letting all the rest of the spinal joints sequence and all the way down through your hips, knees, and ankles, and then reset to what you perceive as the center. And I think what's happening for a lot of us, if we feel a lack of energy or a loss of vital energy, it's because our sensory system is understimulated and our cognitive system is overstimulated. So the more fundamental you can be, if you're doing high cognitive content work, the more access you have to actually fundamental embodiment. I would even hesitate to say skill. I would just say notes that you can play, foundational notes that you can play, really helps reset your system. Okay, thank you so much for watching. I hope this was helpful. Information is below about upcoming cranial nerve sequencing work. This foundational set of movements is what I use to integrate all the separate practices for the 12 different cranial nerves. Okay, peace.